Hello, everyone. Welcome back to another episode on the Growth Over Fear podcast. I'm so excited to be here today with a wonderful guest, Kathleen. She is one of my clients, and it has been amazing to work with her and get to know her on. We've been working a lot on building strength with lifting a little bit heavier weights, building better stability for all her activities because she's very active with skiing and golfing. And Kathleen is, I'm going to read her bio a little bit. So she is a graduate of Indiana University, offering a master's in kinesiology. In addition, the owner and founder of Link Golf and Wellness, which is a small company offering professional golf instruction, fitness, yoga, and golf and wellness retreats. Her passion in life has always been in the health and wellness industry. Having over 35 years of experience in teaching, coaching, and fitness, she stumbled upon shockwave therapy and discovered the amazing benefits of it. After years of receiving several treatments for soft tissue injuries, she decided she wanted to get into the business and help others heal. And after a couple of years of trying to find the right business partner, she landed Dr. Eric and brought in Regen 3 Therapeutics as a new modality to chiropractic. Really amazing person, and also all these businesses and years of experience she has. So she has a lot to bring, and I'm excited for you to be here today. Thanks, Kathleen.
Yay, I'm excited to be here too.
Yay. So let's just go. I kind of gave a little bit of background about you, but I want you to elaborate a little bit more. Like, what brought you into the specifically shockwave therapy and your and fitness in
So I
general?
guess my fitness journey started when I was about probably 14 or 15. Had an eating disorder. Sorry, it's a little loud. There's a helicopter happening
It's okay.
outside. I got into I joined a health club at a very young age and met some bodybuilders, believe it or not. I was still kind of in the midst of this eating disorder and just fell in love with fitness. It was one of those things where I remember my parents, I was one of those kids that, oh, I want to go try this and I want to do that and I want to join a gym and I want to race BMX bikes and I want to blah, blah, blah. And I remember when I came home and I was like, I really want to join a gym and, get into fitness. And my parents like, oh God, here we go again. Well, here we are, 40 some odd years later, still doing it. Fell in love with working out, got into a little bit of bodybuilding. I taught aerobics. My undergraduate was PE and a minor in health. So I love teaching. I was an aerobics coordinator, competed in bodybuilding a couple times. And throughout my journey in the fitness world, starting with, I wouldn't say I was totally unhealthy because I was a competitive swimmer and golfer at a very young age, but really watching how my body has changed and shifted over the years. And I think, having the background and doing all the things that I've done for so long has really put me in a very healthy place. And I really want to teach women, obviously men too, but more women about some of these things and sharing my experience so that, they can just have long, healthy lives. So that's kind of been my fitness. I mean, I just love it. I love you. I
Mm-hmm.
mean, me as a trainer my entire life, I sought out a professional because as I've gotten older, it's been a little bit harder for me to hold on to muscle mass. I'm very grateful for the muscle mass I have, but I think it's never too late to, as an educator and a trainer, like, why not hire somebody? I'm learning a ton from you. I think as we age, I wanted to hire somebody to make sure that I was doing things safely, although I do them on my own. But I'm thinking, I'm kind of at that age where maybe it would be, and I'm learning. I mean,
Mm-hmm.
I'm not a young cookie anymore. And so I learned from you,
That's
which
awesome.
is awesome. But that's kind of my journey into the fitness world. And then the shockwave I stumbled upon. I had an injury in my Achilles tendon, and I came across a gentleman by the name of Dr. Hani Saeed, who's a podiatrist and a surgeon. And I started receiving shockwave treatments. Then he became my podiatrist, and I had a sprained ankle, and I had golfer's elbow, and a shoulder thing, and I had a lot of soft tissue injuries. And I kept referring all this business to him and he just started giving me treatments for free. And I'm like, why am I not going to get into this business? So I had to find a doctor, a PT or a nurse. And I had a doctor, a chiropractor who's a friend of mine. And I said, I really want to get into this business. And I think it's important because as we move into the world of medicine and surgery, there's all these other modalities out there that we can avoid having surgery. And if we can get our
Mm-hmm.
bodies to heal themselves, why wouldn't we use those technologies?
Totally.
Yeah.
Yeah, you're and it's so inspiring just how committed you've been with prioritizing your fitness through all those years, like your whole life. It's really amazing, and that's a big reason why I wanted to have you on to talk about this and women's health and hormonal health and the shockwave therapy too is just, I mean, I've learned so much from you, not knowing what it was, and I think it's still a little bit unknown, and it's been fun to learn more about and express that to clients because, like you said, we want to avoid surgery as much as possible, and I think shockwave therapy can be very beneficial. We'll get into, the our main topic today, but I want to just have you briefly kind of share what is happening with shockwave therapy for people that don't really know what the heck that is, and yeah,
Okay,
how it can be beneficial.
I'll give you my little history. Well, the history of shockwave is interesting. I've told this story many times, and of course, I've learned from a lot of other experts. Shockwave therapy has been around since the 70s. It was originally used for kidney stone removal, which is called lithotripsy. And in the 70s, when people had kidney stones, they put them in a tub of water, and they had these giant cylinders that would apply acoustic sound waves in the water, and they had to have multiple treatments in order to break up the kidney stone because it takes time. And these acoustic sound waves, they discovered shortly after people were doing multiple sessions that their soft tissue injuries or their back pain or whatever started to kind of dissipate. And they were like, holy cow, the healing benefits of acoustic sound waves. I mean, sound waves have been around for what, centuries, just the healing properties of sound waves. So the idea behind shockwave, there's a couple technologies. We have a technology called radial shockwave, which is more of tendinopathies, muscle strains. I wouldn't say subcutaneous, but let's say 1.5 to 2 inch. If I had a deltoid, maybe pull or strain, it's a gun, it's a radial pressure gun that creates these pressure waves, and they're a broad wave, so it covers a broad part of your tissue. It's very loud, it's percussive. It kind of creates what I would call micro tears. It's like micro needling your face. I tell my golfers, it's like aerating the greens. We're creating these little holes and micro trauma to tissue that has possibly been what I consider somewhat calcified or kind of bound together once the blood flow stops. So we get the blood flow into that area with the radial pressure gun. And then the focus device, which is true shockwave. There's a lot of people out there claiming they have shockwave, and we initially thought we did. What we discovered is we have radial pressure wave, which is still in the shockwave family, but it's not true focus shockwave. So the second device we have is a focal wave, and basically it's the same technology that they use for lithotripsy. So if I had maybe like a labral tear or a deep tear in my rotator cuff, this focused wave can actually find the tear, and it starts to recruit stem cells to the injured area. So the true focus shock wave, there's another device out there called soft wave, which it's our competitor, but they're very similar. And I want to mention that because some people are getting soft wave, and I think it's great. But when you enter the focus in these waves, you can recruit those stem cells, and that's what helps the tissue recover faster.
Amazing.
It's
And
it's
who could be, who,
there's a lot of science and
yeah.
biology, but that's kind of the short of it. Now, the thing that I love about it is it's non-invasive. There's no downtime. Generally 3 to 5 sessions. It's between, $200, $300 a session. It's not a lot of money to invest in if you have an injury, and if you take care of it sooner than later, you can get it to regenerate and have the mobility and the function back in that area without having to have surgery if you let it
Yeah.
go long. Yeah.
So incredible. And who could benefit from it?
I
Like
mean,
the best people,
so I mean, right now the sky is the limit. I look
Hmm.
at a lot of high school athletes that have a lot of overuse injuries, and I fear for them as they get older that those overuse injuries are going to turn into chronic tears, things of that nature. So high school athletes, I mean, any athlete, we've got people that have, chronic back pain. The success rate is right around 85%. And I think when we treat a patient that it doesn't work, generally there's some sort of systemic issue possibly going on, or they just truly are not healthy, or we've seen people with autoimmune disorders. It takes a little bit longer for the body to
Hmm.
heal. So, but the success rate's pretty high for
Yeah.
pretty much any active individual that has had minor, also post-op, if people have knee replacements, hip replacements, the technology helps regenerate that tissue so you can heal faster.
And What about like arthritis and osteoarthritis?
Yes, we do have some OA protocols, which we have had a handful of people that are pretty successful because we're healing the tissue kind of around the knee. Sorry, there's all these airplanes. So can you do that? Is it too loud?
Yeah. No, I
Okay.
can't hear it.
Okay, good. Um, the other device that we have is called the magnetolith, which is electromagnetic transduction technology, and it's a high oscillating electromagnetic field that can actually bring down the inflammation in the bone that creates more space. And then we kind of couple it with the shock wave so we can, it's not that we're reversing arthritis, but if we can get the inflammation down and the tissue around like the knee joint and create more space through those technologies, the pain will go down.
Yeah.
So yes, there
And
are OA treatments.
and then when the pain goes down, how long have you seen it last for, if that makes sense? Like, do they have to
So if it's
continuously?
something like an OA, we have a patient, one of my clients, both of her knees, she's due for a knee replacement. So she came to us. I think she had about 5 or 6 treatments because was pretty progressed. And we got her to about 80%. And now what she'll do is maybe come in once a quarter.
Oh, wow.
Like maybe once
Yeah.
every 12 weeks, because the regeneration process in your body is 12 weeks. It kind of dies down. And what you want to do is we want to keep it moving. I mean, this
Mm-hmm.
technology, I mean, you're young, I'm older, everybody in between. If we can get the cells to communicate with each other more and quicker and recruit, that's where the healing begins. So that's
Totally.
where the electromagnetic transduction comes in.
So cool. And I love it for, like you said, like some cases, right? I think using that modality as like a great tool to use in supplemental with strength training and the other factor, right? Like nutrition, like with those autoimmune conditions, right? You have to also use other methods too in conjunction with that to have
Mhm.
great, in my
Yeah,
opinion, right? Like great success too, right?
sure.
Like, um,
I mean, I don't think it's the end all be all. Like I'm a
yeah.
firm believer in physical therapy. Obviously, I'm a firm believer in chiropractic.
Mm-hmm.
It's it is a part-time job taking care of yourself.
Total.
I mean, it
Yes.
is, I always say like when people are like, oh my God, that's so expensive. And I think to myself, you have to invest in your body. I mean,
Mm-hmm.
people go, I've seen these little things like on Facebook, how much money people spend on Starbucks in a year. Put that in the bank and put it towards this other stuff. Like you would have plenty of money.
Oh my gosh. I'd be curious to see that. I'm not,
Yeah.
I wonder what the average, yeah, um, investment people are making. Yeah, like in coffees per day
Yeah.
and yeah, little stuff like that. So true. Yeah, you truly do have to invest in yourself and now rather than later too, where it's even more money for surgery and then all that, yeah,
Yeah.
down the line. And yeah, I love everything about that shockwave therapy and thank you for sharing more about that. I think for people listeners in like the Denver area, where is the Regen 3 Therapeutics?
We are on Colorado Boulevard, so we're in the Galleria building. So we're central Denver.
Okay.
It's pretty
Perfect.
easy to find. Yeah. Yeah.
Perfect.
Yeah.
Yay. Well, let's dive into what kind of inspired you to prioritize fitness throughout your whole life. I know you had the right environment and community as far as when you got into bodybuilding. But as you started to get older, after having, your daughter and things like that, like what inspired you to continue to prioritize it?
I mean, I don't even know that for me, I mean, it is a priority, but it's such a way of life.
Mm-hmm.
And I also just don't believe that you should settle for feeling like shit. I mean, to put it lightly, where I've had so many friends my age, late 40s, 50s, they are starting to feel achy and tired and all these things. And I guess I just like to feel good. I don't want to not feel good.
Yeah.
And I also believe that what possibly has inspired me is when I was at kind of like the height of my eating disorder, because that is a big part of my health journey. Starting at 15 until I was probably well into my early 30s, which is, kind of crazy. And it went
Yeah.
through all sorts of phases. Is I think I woke up one day and I just didn't want to feel like shit anymore. Like I was at that place and I had met a doctor. It's actually the Eating Treatment Center in Denver, which is a nationally known eating treatment center. It's amazing. At that time he didn't have a giant eating trip, but I did find this psychiatrist. And I think a lot of mine I discovered down the road was driven by a lot of anxiety, very,
Mm-hmm.
kind of high energy. And as I kind of morphosed out of it, I just remember the day where I finally was like, I don't want to feel like crap anymore, you know? And I think that was such a motivating factor. Maybe that's me hitting rock bottom with an eating disorder, like an alcoholic or an addict or whatever, because it was
Mm-hmm.
a form of an addiction in
Yeah.
my mind, where I just want to feel good. Now that's my addiction, right?
Yes.
So, and I love inspiring other people, whether it's, women or men. And I also think like, I just want people to feel good, like whether it's golfing or working out or being happy or my kid or whatever. And you have to take care of your body and eat good foods to feel good,
Mm-hmm.
I think.
100%. Yeah. And it's such a motivating factor when you look at it that way. Like, I don't want to settle for this feeling. Like and you don't need to, right? Like when you take control of what you can and what you are putting in your body, how you're moving daily, like all the little things. When when we talk about that period of time, so let's say like 30s, late 30s, 40, what when did you start first noticing like hormonal changes and what were those symptoms for you?
So I got pregnant very easily at 40 and had my daughter at 41, which was crazy. So I feel like I was blessed with good parts and didn't have any issues with that. And I was healthy, right?
Mm-hmm.
I really do think after I had my daughter, I mean, it was a lot getting married, having a baby, all of those things, sliding into your 40s. I would say my mid 40s was when, of course, I thought it was all just, having a kid and getting married, but I would say probably my mid 40s. And I say that because when I was on birth control as a young woman, I never had PMS. I just wasn't that person that, like, I had roommates in college that were like, oh my God, I can't move. I'm in bed. And again, maybe because I was active, maybe because I worked out all the time. I don't know the answer to that. But I think that I started with kind of like the night sweats, which I think a
Okay.
lot of women, even in their early 40s, start to experience. So, of course, I started doing kind of this deep dive, and I've been doing acupuncture. I've been doing so many things for so many years. So I had a lot of resources. So I started with some acupuncture, started with some herbs, found cohosh. I found chaseberry. I found all these different adaptogens that I felt like kind of filled the bill for a while. The mood swings, the brain fog, the libido. I mean, there's all these things
Mm,
that are really, really hard for women. And I feel for other women, generations prior to mine and yours, and that didn't have these resources. And
100%.
early in my 40s, I think I was like, oh, I'm never going to do hormone replacement therapy. Oh my God, that causes cancer. I am not doing anything synthetic. I said this, which is kind of funny. Like, but then again, social media, all this research, then it was some hot flashes, not sleeping. My body has not changed that much. And I'm super grateful that I did have a
Yeah.
time period where like my breasts were kind of doing some weird stuff. Like one was really big and they get really big. And then, I mean, it was the craziest stuff. Like and then you think, oh my God, am I going to gain all this weight? And then it would go,
Yeah.
but none of it was very comfortable. I think the lack of sleep is the hardest for any mothers, really any
Totally.
women.
Yeah.
Yeah.
Yeah. I
So,
mean, it's crazy like when again, obviously, right, I'm not at that age yet, but
not
doing my
even
own research,
close. Right.
not even close, but knowing that research of like all the symptoms, right? It can be many, many, many different things. But like you said, the most common ones are like hot flashes, night sweats, yeah, weight gain, especially around the
Moodiness.
waist, moodiness, decreased libido, joint muscle pain, fatigue.
That's a big one. The joint muscle pain, I will say now, I didn't have a ton of that, but I've had friends that I have referred to this nurse practitioner that I see, Jennifer Mooney, where the minute they get on progesterone, that stuff starts to dissipate because
Wow.
progesterone is a great anti-inflammatory.
Dang. So
I
crazy.
mean, and sleeping.
And
Not
sleeping,
waking
yeah.
up. Yeah. I had a
Yeah.
friend who she was waking up and just aching all the time and felt so bad. And I think I shared the story with you. And she went to her primary and they're like, I think you should get tested for lupus.
What?
Lupus.
Because she
Because
was,
OBs don't, and a lot of primaries know nothing about hormones.
mm-hmm.
So,
I
all the
know.
body aches and the joint pain have been misdiagnosed along with anxiety, depression, all these other things.
Yes. And that's what wanted to kind of quickly share too about again, I did some research before this that one
Yeah.
in five women age, yeah, like 40 to 50, not, menopausal age in the US are on antidepressants. Like that's usually the like
Yeah.
SRIs are the most likely given to women for a hot flash. Like if they go into their primary and they're like, I'm having hot flashes, and
And
that just
gabapentin.
gabapen.
Gabapentin, which is a medication
Oh,
for seizures. I had a golf client, we were on a retreat, and she had these horrible hot flashes. And I was like, oh, what are you taking? She's like, oh, my OB gave me gabapentin. It's for seizures
so
and
interesting.
like
But
neuropathy.
yeah, and then I was like, why would they give us SRIs, right? Like hot flash, how would that have anything? But I think it's from SRIs, right? Like stabilize the hypothalamus,
Uh-huh.
so it helps for when considering hormonal therapy. Like that's more going to be the more reasonable
Right.
treatment. But yeah, I thought that was very fascinating. Like 20 to 30 women are experiencing those depressive symptoms during perimenopause, menopause, and I feel like I hear that too. And then they're prescribed antidepressants, even
And
though,
anxiety meds. So,
yeah, and,
so estrogen, and that's kind of my thing. I've always kind of had that anxiety issue. That's
mhm.
one of the reasons when I was actually, when I found that doctor here in, or excuse me, in Denver, Dr. Weiner, at that time, believe it or not, it was when Zoloft first came out. He put me on 100 milligrams of Zoloft, and that is what actually got me out of my eating disorder. Now, I'm grateful for that in that moment, and maybe it could be different now, but for me, that really helped get my anxiety down and under control. But I will say the thing with estrogen is when estrogen kind of like really rises quite quickly, so in your cycle, all of a sudden, and I would have these moments prior to getting on some of the HRT, and or we love to call it now the hormone optimization, which I
Yes.
love that. That was also Jennifer Mooney, this nurse practitioner, where I had a panic attack like 6 months ago. I had never, ever, I like woke up, I was like, what is going on? And that a lot of it was hard. I've never had one since. But what was
Mm,
interesting, Sarah, is I was telling all my friends, oh, you've never had one? Like, that's normal. I'm like, I never want to have one again. I thought I was gonna have to go to the hospital. I thought I was having a heart attack.
yeah, it's scary. I experienced those, yeah, when I was in college, and I've shared on the podcast before, like dealing with anxiety during college, and that was kind of like similar, not quite like eating disorder, but definitely
Right,
just like overdoing it, hard,
right.
balls to the wall, like hard workouts, under eating, just putting a lot of stress on my body, which led to a lot of anxiety because I
Yep.
wasn't down regulating,
Mhm.
and yeah, it's a scary feeling when you have those panic attacks, and um, but yeah, I think like it's the hormonal changes can mimic and contribute to those, like you're saying, those mood changes, anxiety, depression, making it hard to distinguish between like if it's, you know, um, actual clinical, depression or menopause related mood shifts. But I think it's all connected, right? Like your body, a lot is shifting with your hormonal levels, which is going to affect the mood, right? Affect your brain and how you're functioning. So, were there any other surprises though about that menopause, like the transition that you weren't expecting?
I mean, it hasn't been quite a year, but I'm almost at my year mark. But according to my blood work, I am in menopause, which is kind of interesting. But I would say in the last year or two, holding on to muscle mass. Like
Mm,
that's been, I can definitely tell. I mean, I still feel like I have a good, and we've trained together. I still have it, but I think I have it because I've had it for a long time, but I want to
yeah.
maintain it. I'm trying to think what else. I mean, obviously skin, I do collagen. I think that's important. There's so many things out there. You and I, we've talked, there's so much information out there, like almost information overload, but estrogen helps with collagen production. So why not just, throw a little bit extra in? I think brain fog has been, that's a tough one where,
Mm-hmm.
and I think, I mean, I say this, I'm laughing because I remember one day you were like, what were we just doing? I was like, wait, you're younger than me. You shouldn't have brain fog. So I think that it's a normal thing. And I think though, when you get older, you tend to analyze it more. I'm not saying that the hormones aren't a part of it.
Yeah.
I saw this woman at this event years ago, and I think she was probably like in her 80s. And she was this amazing speaker. And this is kind of one of those things that just, you'll always remember. She mentioned something like, as we age, you start to pay attention to all these things that you hear are not supposed to work. So they seem more prevalent. But I'm pretty sure when you were a teenager or whomever, or a young woman like you, that you literally went to the refrigerator and you forgot what you were looking for. Like
Yeah.
it's all kind of been going on for a long
Yeah.
time.
Yes.
But I do think that we can also freak ourselves out about that
Totally.
stuff. Because my daughter's 15. She's like, I can't believe I forgot what I was just going to say. I'm
I was
like,
gonna
well,
say
you make me feel so much better because you're my daughter and you're only 15.
that's such a good point to make though. Like, yes, it's very common no matter what age you are. Like those little, yeah, like what am I doing? Like, but like you're
It is
saying,
a
I
true
think,
thing. It's a
but
true thing.
but I think when yeah, you're at those ages, like when you're a woman, knowing that perimenopause is coming or menopause, you start like you're saying overanalyze because you know it's coming or you know you should feel changes, right? Quote unquote. So
Right.
like you start not looking for them, but probably like psychologically, right? That you start noticing different things or it's just overthinking if this is actually a symptom or yeah, I could see how that could be very
But I also
challenging.
think the whole entire process is psychological too. Like it's like I don't know if I can cuss on your
Yeah,
podcast.
it's
I
fine.
mean, it's kind of a mind fuck. And I've said that to my husband. I'm like, you don't understand. Like you go through this world as feeling feminine and beautiful and young and all these things. And as we age as women and these things start to shift, there is definitely this side, at least for me, where it's like, I don't want to not feel feminine and sexy and all these wonderful things, but it kind of happens too at the same time. And that is psychologically hard.
Really hard. And yeah, let's before we get into the mindset kind of piece, I wanted to also share, which you again express um seeing a little bit of muscle loss and how that's, really important that you maintain and how yeah, we like know, right? Like 3 to 10% of your muscle mass is you're losing that per decade after 30 and even more acceleration when you're in that menopausal age after 45, usually
Yeah.
45 to 50. And I wanted to share that and then also how have you listened to Mary Claire?
Oh
Mary?
yeah, I listened to her like 2 or 3 years ago, and I've sent that podcast to everybody.
And I'll maybe put that in the show notes.
Yeah,
For those that don't know,
she's
Mary,
great.
I can't remember.
When anytime I send that to any of my friends that are going through this, they're like, "Oh my God, that is amazing!" And I mean, I'm still really shocked. There's not more I think there is. They call themselves the Menopause, which I think is
Oh,
brilliant. She does. She and a bunch of
it's
OB.
fun. That's so fun.
She calls her, and she's like, "I'll go to my grave with my HRT patch." Like she's like, "I'll put it on until I die."
I
I mean, I
love
think
it.
that's hilarious.
Yes, it's
Why not?
hilarious.
Yeah.
So, for those that don't know, Dr. Mary Claire Haver, she's
Uh-huh.
on a lot of podcasts and she's, yeah, the menopause doctor. Like, she's definitely check her out. She has a bunch of great information and natural, like, she has different pillars for menopause and just great information overall.
Mhm.
And she was sharing how one that you didn't experience, but a lot of women do, is yes, start like gaining weight, especially around the waist. And due to right estrogen dropping, we she says how important it is to not have that visceral fat right around the waist and
Mhm.
keeping it under 35 inches is optimal, right? Because visceral fat, like the higher it is, the higher chance that you have osteoporosis, higher
Mhm.
levels of cortisol. And usually that's probably due to a lot of women we think of are doing lots of hit, lots of
Oh yeah.
cardio,
Yes. Too
lower
much.
too
Yeah.
much, and just, all right, I should start eating less then because I'm, seeing my waist get bigger when there's just a lot of hormonal changes happening. I think, and she gave this statistic too, that 8%, I think women have 8% visceral fat in perimenopause. In menopause, 23% visceral fat. Like that's
Wow.
probably what's most common.
Hmm.
And so going into that, what like have you adjusted your workouts over time now? I know obviously we're strength training and maybe you can share more about that, but what role does that have in playing in maintaining the bone density, muscle mass, and staying strong for you?
I mean, my work has always been physical, which I think has been a blessing, right? I've been on my feet, I'm always moving, and maybe I'm kind of in that little like revving kind of fat burning phase. I've never been a
Mm-hmm.
big cardio girl. Obviously I ski, but I'm not, on a treadmill or running or doing anything like that. I do think that, the weights for me, just having the muscle mass has helped my metabolism, number one. Uh, I also think genetics, I think I have good genetics. I mean, my sister is 2.5 years older than me, and she's so tiny. She's never gained any weight around her, midsection. My mom, I don't know, but, I do really believe some of this can be genetics. But I think for me, I know that if I don't keep lifting, and try to lift heavier with you. Even on my own, I did a workout today. I did a couple things. I'm like, should I lift that heavy? I wonder what, I'm always kind of thinking like, because I want to be safe in my own body
Yes.
because I'm not, I mean, I'm strong, but I may not be as strong as I think I am. Although, as I've gotten older, even my workouts have changed. I mean, when I was teaching aerobics and bodybuilding, I mean, I was in the gym 2 hours, an hour and a half.
Mm-hmm.
There's no way in hell I could ever work out that long anymore. Like I like working out with you an hour, but usually when I work out by myself, I'll do kind of like some circuit where I'm just moving and maybe doing more high intensity and then more heavy with you. So I think the combo of the two.
Mm-hmm.
I did do a bone density test. I mean, they said I had a little osteopenia in my lower lumbar, which I was kind of surprised. So I'd like to try and reverse that, which
Mm-hmm.
I know you and I are working on. So, and I think just mentally, like when I work out, it just keeps me the clarity, like in your brain. I mean, it's so good for your brain, like dopamine in general. That's why I'm always
Yeah.
surprised. I'm like, how do you not want to work out? And I'm sure you have people like
Well,
that.
it's hard. Yeah, like especially if right, like say right, a woman is getting yeah, she's in her 40s, right, and she hasn't really had a base like you've had, right, where you've been working out your whole life. What would you, like, I guess, like say to her to, or like what would you kind of tips for just starting that workout routine?
Hire somebody. I mean, I'm all about it. Like, even as a golf pro, I'm like, why wouldn't you hire a trainer? Why wouldn't you hire a PT? Why wouldn't you hire all these people that are professionals to at least get you started? And I think, having my husband who he's fit, but it just, I sometimes just have to forget it's like brushing my teeth, right? Like,
Mm-hmm.
just go in the gym and lift some weights and move your body. But there's also still that kind of old school of, well, I'm going to go to 24-hour fitness and I'm going to do the circuit, which is better than nothing, don't get me wrong. But I don't necessarily know of, over the years of me training people or yoga or whatever it is, that just the people have such a lack of body awareness. And with a trainer or whoever, at least you learn how to work out properly so you don't get hurt, so you see results, so you understand your body. Like those are the things that just kind of blow me away a little bit. And again, here we are back to it's an investment,
Yeah, it is.
you know?
Yeah.
So
And but it's like you said, it's worth it because then you have that foundation. Like at least you are learning effective technique, form, how to just start doing it on your own because that's the
right,
optimal goal. Like especially when a client comes to me, like I want you to just learn, be educated to know how to move properly in the gym
right.
safely, so that way you can do it on your own for the rest of your life. Like that's the end goal is like
Yeah.
for you to maintain a strength training routine focusing on, the compound movements. So I've talked about it before, like squat, hinge, lunge, push, pull, rotate, like core, movements as well. Like that's all, as long as you're including all those, that's the most important thing. And I would say, for anyone listening that doesn't already have that routine and maybe hiring isn't optimal, like focus on those movements, getting really good at them at least twice a week, like
Mhm.
minimum, you know?
Yeah. And I think unless, and there's so many videos out there, right? Like there's just a slew of them. And same thing with golf. I hear these people, well, I saw this video and it's like, you saw the video, but nobody knows what your body's doing.
Mm-hmm.
Like you can see these videos, but if you have somebody like you watching them or me watching their golf swing and how their body moves, they're going to get hurt
Yep.
or something
Yep.
is, it's just not going to work. And then they give up.
100%.
I'd
And
say like take if I were to speak to all of your listeners, I would say take $1,000 and invest it in a trainer. although it sounds like a lot of money, but maybe you get like, I don't know, 8 to 10 sessions. And then, I mean, at least you have that foundation. But to me, it's worth the money,
Totally.
you know?
And like also looking at, you know, being strong rather than skinny. Like, yes, like say the woman, right, you're wanting to lose weight, kind of shifting that perspective of you might lose weight while you're starting to move more and be more active and kind of shifting that focus to strength. Like so many benefits for having more muscle on your body, stamina, resilience. Like I think we need to stop chasing that number on the scale and just think of strength training as making you feel powerful
Mhm.
because of what you can do from building muscle and having that on your body. Like, I'm sure you could attest to that, right? With like being active. I mean, you guys, Kathleen is fit. She's strong. You have very defined arms. Like, you are such great. I love it. She
Thank
was
you. The
flex.
genetics, but yes.
Um, but yeah, like what has it gave you the capacity to do?
What has given me what?
Like the strength training, like what are you able, what does it give you the confidence or resilience to do outside of the gym?
With you or on my own or both?
Both.
Because I already feel stronger working out with you. Like
Amazing.
yeah,
Yeah.
I mean, so there's a level of, well, I think number one is, having more confidence maybe in some of the things that I wanted to do. Now I know I can do them
Mm-hmm.
without getting hurt. Like
100%. Yeah.
that's important. I also just think, and you and I have talked about this. I think women need to realize the importance of muscle mass. I mean, just from a longevity perspective, like Gabrielle Lyons, you and I have talked about her, this doctor, and that was probably what motivated me. Of course, I don't think I can eat 130 grams of protein every day. I mean, I'm trying my best. There's all this stuff about protein, but I think when I'm doing these kind of workouts, the other thing that motivates me is if I can continue to work on balance and stability and strength and proprioception, that I'm not going to fall when I'm 75 and crack my head and die. Like balance is everything. Stabilizing muscles are everything. And I tell all my clients that. I don't care, from if they're 40 or 65, like you have to have balance.
Mm-hmm.
So I think from a longevity perspective, I want to ski and, ride my bike and play golf and do these things and move my body as long as I possibly can. Now, is it different than it was 20 years ago? For sure. Do I have little aches and pains that I didn't 20 years ago? Yeah, but I know how to manage them. I know how to
Yes.
stretch. I know how to build. Like, we're just not going to go through life without some sort of discomfort, right?
Mm-hmm.
And I think sometimes people will go so long feeling so crappy, which you and I have also talked about. They don't know what it feels like to feel good,
Yeah.
like what optimal health really feels like in their body.
And it's really not settling for that discomfort, right? Like not just letting it be
No.
like, oh, it's like this is part of aging. This is part of how it's supposed to be.
Right.
Like
Well, you're just
it,
going to get fat and gain weight and feel like shit. Sorry.
like
Like,
no.
no,
There's
not accepting.
bunch of evidence to prove,
Yeah.
yeah, like you can stay healthy and again, like you said, it's inevitable, like you're gonna have discomfort and aches and pains, but being able to manage that and
Right.
stay active and stay moving, like that's the goal, is like being able to like get back up and keep doing what you want to do. Play with your
Yeah.
grandkids, play with your kids.
Yeah. Well, and I'm gonna kind of back up with the
Yeah.
age is what also is really interesting is, and maybe this is, estrogen in our environment, but I'm starting to see and kind of learn a little bit more, like even you as a young woman, but why are all these other young women having so much anxiety? Is it estrogen dominant in it? Is it social media? Like, why is it so bad? Why are young girls so anxious? Why do I, every time I try, oh, my daughter has anxiety. I have anxiety. Everybody has anxiety. Is it food? Is it environment? Is it estrogen? Like, what is it?
I think it's a combination of
Yeah.
all those
Yeah.
things. 100%. But yes, I agree. Like I think we're seeing it more and more. And I think that's why I love this pot, like doing this because I want to educate people that there's a lot you can do. It's multifactorial. I think it's, the toxins in our environment. I think it's the social media. And I mean, so, yeah, like social media and phones are a big piece of that. Like always having constant information thrown at you and like it puts you in overdrive.
Mm-hmm.
And you're
Cortisol
and
levels.
yes, like you're on a fear-based cycle of yeah, like something's gonna go wrong, like and then you hear what else is going on in the world. Like there's so many
Yeah.
factors, but um Yeah. So I think when
But
it
young
comes,
women and older women, like
yes.
I just see like I was talking to this friend of mine the other day, and you've got these 10-year-olds that are starting their period, and it's like, is it hormones? Is it cortisol? Is it like they're all these things? I don't always think it's just food, but I know
No.
cortisol levels, when those are higher in young women, the estrogen levels can increase too.
Hmm.
Like there's just so many, and I don't think a lot of women or mothers immediately they'll go to their pediatrician. Well, Johnny has anxiety. Well, we should probably put him on anxiety meds. Anyway,
Yeah.
that's another
I
podcast.
know that's another podcast. I was like, I could keep going, but yeah, we'll stop it there.
Okay.
Um, okay, so now the tangible thing. So like what you did, I know you mentioned a few herbs and things, but like,
Oh, okay. So,
so what, yeah, like specific foods, supplements, herbs
I
that
mean,
optimize your
yeah,
health.
I have done, I will say, tell one thing that I've always done, which is so funny. And I read this years ago. I started doing kelp probably 30 years ago. And I see it's for your thyroid. Not that I ever had a thyroid issue, but iodine is really good for thyroid health. And again, so many women my age, and I don't know if it's thyroid. Every time I have hypothyroidism, I'm on Synthroid. Like there's so many things thrown at you. So I do omegas, I do the magnesium glycinate. I had hormonal headache. So I definitely would recommend any of your listeners, if you're suffering from, intense migraines, it can be hormonal for sure. And I never had migraines until I had a baby and got married. And that's kind of my ongoing joke. But I think my hormones shifted after I had a baby. And I just, like I said, I never had headaches. So the magnesium glycinate, omegas, kelp, I do a supplement that has like turmeric and hyaluronic acid and things like that in it. It's a company actually, this Hani Saeed. It's for OA, not that I have OA, but it has like Boswell. It has a lot of things in it that keeps the inflammation down in your body. I don't
Hmm.
believe I have a ton of inflammation because I eat a pretty good diet. Let's see, what else do I do?
What were the herbs that were really helpful?
Well, the black cohosh is really good. That is an adaptogen for progesterone, and then chasteberry. Wait, which one is? Now I can't remember. There's a couple different ones, and you can look some of this stuff up. But I mean, I would even say if anybody like between 35 and 45 are starting to experience perimenopause, which supposedly that's when I guess it can happen that early on. I don't know. Um, you can start these patches and things like that very young. And I think what's great about that is, maybe some of these women that aren't able to conceive, I mean, this could all be hormonal stuff too, right? Like I was
Hmm.
blessed to be conceived with just blinking at 40, and that was amazing. But I do think that I just don't want people to be scared of these patches and these things now, because there's so much research out there and you can get, a lot of relief.
With the hormonal replacement therapy.
Yeah, like the patches, progesterone, things of that nature. But I do think there's a lot of, going to an acupuncturist or Chinese herbs, really kind of looking into, some of the Chinese herbal medicine that can really help with, PMS symptoms, things of that nature. I met a young woman who started this company called think it's Wave By. I actually would love for you to meet her because I think you guys could do a great podcast. And she's working on some supplements for teenagers and
Wow.
younger women that are really experiencing very bad PMS. So I do
Hmm.
think this stuff probably starts a little bit earlier than we think, but being able to educate you through this whole journey. And I always think too, like, is that why so many women end up divorcing their husbands in their 50s because they're in menopause and they just can't even take it anymore? Like the stuff that goes on, right? Like there's that,
Yes.
or
Yeah.
people split up because the woman or they lose their job or whatever. But I'm trying to think. I mean, I do take CoQ10, and I still take that for my headaches, but my headaches have been great since I got on these.
Good.
Yeah, yeah. And I don't drink a lot. I think I'm noticing a lot of friends, a good friend of mine, she's like, I just can't even drink anymore. My hot flashes are bad. I'm like, this. I mean, if you went on hormone replacement, you could probably drink more, although you probably shouldn't drink more, but it would help,
Yeah.
So,
Yeah. And yeah, and sometimes that can make things a little worse. Yeah, like how
mhm.
you're feeling, like the hot flashes and stuff. And
You
then
just
what
can't
about,
metabolize it.
yeah.
You cannot metabolize alcohol when you get older. It's crazy.
What
It's really.
about the you take creatine?
Oh yeah, sorry. Yes, I forgot about that. Oh, that stuff. Yeah. So the creatine monohydrate I take the collagen. I love the creatine. I will say something about that. It definitely, I think, helps with brain health too. I think you and I kind of talked about that.
Yeah.
But I do
Yeah.
5 milligrams, although Gabrielle recommends 12. I don't know about that. That seems high, but I don't know.
Yeah. Yeah, and I mean, what I've looked, yeah, for sure, if someone is not taking it, I would highly recommend getting on creatine. Again, we now know like it's not just for bodybuilders, right? It's for everyone to optimize, yeah, brain health, recovery, maintain, bone density. Just 5 grams a day. You can, they say you can slowly, start at 3 and then go to 5 if you really
Mhm.
want to ease yourself into it. But yeah, so much research. I mean, it's the most research supplement. So it's like, it's funny that there's still people that are like nervous about it, but I personally haven't noticed any, or like I notice a lot of benefit from it, right? Like people
Right,
sometimes think, oh, you're gonna bloat a lot, and maybe a little bit. Like when you're first starting it, but if you're optimizing your hydration and you're
right.
already getting enough water throughout the day and minerals, you should be fine.
And I think the other thing too, just to kind of back up to like talk a little bit about what happens to your soft tissue, right? Like this is the
Mm,
other thing that I love about Shockwave is we're seeing a lot of women that are either perimenopausal or menopausal with frozen shoulder. Like your soft tissue changes. So all of a sudden you fall on the slopes and you tear your ACL. It was not from the fall from the slopes. It was probably something that was brewing or your tissue has changed. So I think if any women are out there listening that are like in their 40s that still want to optimize their athleticism and stay strong without injury and they're experiencing perimenopause, I would definitely get on something because it
mm-hmm.
just helps with the collagen production and the lubrication, like all of it. I mean,
Yes.
that I think is a big deal.
Super big deal.
Yeah.
Yeah, I mean, estrogen, right? It's like anti-inflammatory
Mhm.
and, helps your immune function. So, like, when you go in menopause, right, all that's why all these symptoms start to develop
Yeah.
because, yeah, you don't
And
have,
digestion.
yes.
I would say, I am a big fan of colonics. I do colonics quarterly with the gal. And again, I see a lot of women, their digestion starts to change. I mean, everything starts to change and people don't understand it. I had a friend that she just turned 50 this year and she had off and on a urinary tract infection. These things come up and a lot of it is because of hormones. It's crazy.
It's so
She
wild.
did like 3 or 4 rounds of antibiotics. It was that bad. Now she's not even an antibiotic person. Like
Wow.
she's totally healthy and she couldn't get rid of it. So there's all these bodily functions
I,
that really start
everything shifts. Yeah.
everything
So I
shifts.
think the more, yeah, we are, you educate yourself on all the different things that you can do to
Mhm.
optimize your hormones. Like you said, those specific supplements and or like herbs like are really beneficial. I mean,
Yeah.
making sure, not just going on all these random supplements. Like I think definitely do your research. And
Yeah.
again, I'm happy to look at different, I love looking at different supplements with making sure they're third party tested and like actually, have done research or they're organic herbs. Like most
Hmm.
importantly too. Chaseberry, I've heard great things. Yeah, black cohosh and saffron is good. Shishandra. I always say it wrong, but yeah.
Some people like ashwagandha. I don't take ashwagandha. That's another good
Mm-hmm.
supplement. I think sleep is still probably my biggest thing. I definitely sleep better. I do theanine at night. And also I'll do one in the morning and one at night. I think theanine is great just for an overall kind of
Yeah,
calmness.
I agree.
Yeah.
And then what about any other nutrition adjustments that you made to support your energy?
I mean, yeah, I definitely am paying more attention to protein. I think I can't. I'm one of those people though. I'm kind of a grazer.
Mm-hmm.
I don't like to eat big meals, and maybe it was just from digestion as a kid and all the things I did to my body that weren't healthy for so many years. But I always eat a great breakfast. I try to have vegetables, 2 or 3 times a day. I don't eat a ton
Yeah.
of fruit. I've also heard that that's not a bad thing. At least I'm getting my vegetables in. Obviously water. I mean, even more important in Colorado, they say your body weight divided by 2 and then add 20 uh
Mm-hmm.
more ounces.
Yeah.
That's a lot. That's almost 100 ounces of water. So I gotta eat 100
Yeah.
grams of protein, 100 ounces of water.
Easy. 100, 100. You
I
can
know, 100,
remember.
100.
But
Um,
yeah, protein is huge for
yeah,
sure.
yeah. But I
Especially
can't really think of anything else. I really like, I just eat foods that make me feel good. I try.
yeah, yeah.
I
And
definitely
the fact that you're getting, a lot of vegetables in, fiber, like fiber is a huge one too,
is
making sure.
also big for women. Yep. Yeah. Really for everybody, obviously.
Yeah.
Yeah. I
Yeah.
love vegetables. Love vegetables.
Good. And what about well, I kind of already asked you the big challenges, but in terms of like mindset, like around just all of this, right? The time of your life, right? I think there's different seasons, and that's why it's so interesting as a woman. When you're at a younger age, you have, specific issues you're going through, and then college, and then pre-adulthood, like me, like a young adult. Like there's different challenges you have throughout these different seasons of your life. But now being where you are now, what are the biggest challenges you're facing, and how are you kind of managing that mentally?
That's a huge
I
question.
know it's a loaded question.
It is a loaded question. Let's see. I have moments of I am so grateful, I'm so healthy as I'm aging, and then I have moments of this sucks. Do you know what I mean? Like, you
Never in
know,
between. Yeah.
yeah, I mean, I think you just have to I think for women, gracefully aging and accepting aging is one of the hardest things in our lives. And I think that's, when you as you age, when I look back, like we were at the pool today, I was thinking, oh God, I remember when I was a kid and hanging out at the pool, and just and time. Like time. And even since COVID, I see this. And even with my daughter who's 15, and you may agree, you too, and you're young, it's like, I don't know if it's from phones or technology, but time is just like, it's too fast. And I think it's because we aren't present enough. Because my generation, your parents' probably generations, probably similar generation, it's like, you know, we were outside all day. We were not on phones. We had freedom. We were moving. We were active. We were creative, all those things. I think sometimes that saddens me more than getting old.
Mm.
We just
So,
talked about, like as far as that connection. I mean, during COVID, I was so grateful for my work because I was able to be outside and work. But if I had to be on lockdown, I probably would have absolutely lost my mind because I am a person of connection. That's what
hmm
you are too. That's what we do for a living. We connect with people. We want people to feel good. We want to coach and teach. And that is slipping through our fingers, but I do have faith when I see younger generations like you and people that I meet that are, kind of millennials and Gen Z, and hopefully my daughter, that some of that starts to come back because it's a little frightening to me in a sense. And that also makes people healthy and happy.
100, yes, that's a big component of our health that I don't think we spend enough time talking about. I think, there's some people starting to express that more, like getting out in nature, right? In sunlight, like people are talking about that more, but the piece of connection, like you're saying, is definitely a huge piece. And with how busy our lifestyle is now with, like you said, social media or technology, yeah, I think it forces you not to be where your feet are. Like,
Mm-hmm.
because again, information overload, whether it's fear of missing out, so you're like on social media. I don't know what it is, but I think it's a combination of all those things that time is going by too fast. And so what helps you be more present? Like, is there any like mindset techniques or as far as like, meditation, journaling, anything like it could be anything that helps you be more present or just mentally feel
Music, music. I mean, like if anything can change my mood and get me into like the present moment. Now, granted, it is a headset, by the way, is music.
I love
Like
it.
that is, and then also too, I do try to get up. I mean, I am definitely an early riser. I do like to be up in the morning and kind of drink my coffee. Sometimes I'll read, sometimes I'll play Wordle. I did have a strong meditation practice for many years. I don't really anymore. I do try to journal. I did that for several years. I don't do that much anymore. Um, you know, maybe being more present with my daughter and my husband, but it's hard. It's not easy. You wake up and I've got my laptop and you wake up and got my phone. I mean, if somebody could just, you know, remove all of that stuff, right? Like I love it sometimes when I'll go run errands with my daughter now that she's driving and I just won't take my phone
Oh, that's awesome.
because she has hers, but I just won't take mine.
Yeah.
And that's actually, it's funny. I'll do that on occasion. Same thing with my husband, or if all three of us are together and we're going out, why do I need my phone? The only
Oh
people I
my
need to
God.
connect with right now is my husband and
Yeah.
my daughter. So I'll just take it
Yeah.
home. So those are maybe the little things.
The
Um,
little things matter though. And
yeah,
it's almost like setting boundaries with it. Like we
yeah,
can't really get rid of it, but yeah, like setting boundaries with it. Like, and it's funny you mentioned that because I'll do that sometimes. I don't do it often, I will say, but I have done it a few times where I was like, nope, we're gonna go on a walk, but I'm not gonna bring my phone. Because usually
yeah,
I'll listen to a podcast and walk,
right.
and and the few times I did, I was like, that was so nice.
Yeah, and I never like, I will say this, I never take my phone on walks with my dog. Or, I just don't. I just
Hmm.
can't. I mean, I think I tried it one time and I think that because you're outside, you kind of want to get the sound of nature,
Hmm.
although sometimes if you're close to the city, that's a little disruptive. But um no, that's just one thing that my husband always listens to a podcast. I'm like, why don't you just not listen to something? Right. I mean, I don't
But
know. That's just
but
me.
well, and that's a great tip. Like I think like those little things do matter, and I think people can kind of use that a little bit of yeah, whether it's just going to the store, like don't bring your phone, or going on a walk, or just something like that where you're
Yeah.
having designated time throughout your day that's without technology to be more present and be where you're like literally have a clear mind. Like have
Yeah.
time to come up with thoughts, problem solve, with what happened that day or like that's where you think, right? We don't really have time to just like think and reflect. And
Working out, I mean, I feel like workouts for me when I'm home. I mean, I'm always, jamming out to my tunes. I come up with some of the best ideas when I'm working out, where I'm like, oh my God, I better write this shit down because I forget. So those always get those creative juices
mm-hmm,
flowing.
so good.
So
What would you tell women in their 40s and 50s who are feeling discouraged about aging and
I mean, I
maintaining
would
their
say
fitness?
find, get your blood work done and find a really good nurse practitioner. Don't, not to knock OBs. And I'm not saying that OBs, I said they are great for finding cancer in our vagina and delivering babies, most of them, and that's their job. And obviously we need that, but they don't know a lot about hormones. So if you're really struggling, like find a nurse practitioner. I mean, Jennifer Mooney, I'll say her name till I'm blue in the face. She's great. She's educated. Find somebody that's going to give you time so that you understand what's going on. And then you can decide what you want to do, but to not be afraid of any of this hormone stuff, right? I don't think I will say this, do not order this stuff online. There are these websites out there, the hers and the him, you can order all this stuff online. I would say don't do that. Like find somebody that you can sit down with and have a conversation with and get your blood work done and get a metabolic panel done. A lot of these doctors will just do the CBC. Oh, you're fine. Well, that doesn't look at the whole panel, right? You know
Mm-hmm.
this with some of the stuff you're doing. Um, and I think that is one of the most I've referred a lot of, people to Jennifer because and every person has said she's so good because she sits there, she listens, and she educates you. And I think most of us in the world of medicine or healthcare or, integrative stuff, like people want to be heard and they want you to listen and then they want you to educate them
Mm-hmm.
because most doctor's appointments are 15 minutes and you're out the door and it's a
Yeah.
script. Try this, come back in a month.
Mm-hmm. In a
So,
month. Yeah, and that's the
yeah,
thing. Such great advice,
yeah,
especially yeah, to be heard, listened to, and have an actual approach that works for you and not just
yeah,
like this is a generalized, yeah,
yeah.
thing like prescription.
Right. And even like, and I'm just seeing this and learning more women that are having problems, conceiving or just hormonally. I mean, some of this is starting in like mid to late 30s, which
Mm-hmm.
blows me away.
Yeah.
And so not to be afraid, like to go just get your labs and get a hormone panel. Like a lot of lab works for primaries are just like the basic CVC, right? They don't do a hormone panel. Like if
Yeah.
any women are really struggling with this stuff and they're like, okay, something is not right, go get a full hormone panel and see
Yeah.
what's going
Yeah.
on.
And just to have answers. Like the tests, like don't guess,
Right.
test. Like,
Right.
right? Like
Yeah.
actually have the data. And that's exciting about the program I'm doing and kind of share a little bit with the integrative health. I can
Yes.
do that now. I can test
Oh,
hormones,
yay.
adrenals, thyroid. So that's really exciting. So I can really see like where your levels are at and yeah, help with that too. So that's really cool. What do you, is there anything you wish you would have known earlier?
Wish I would I I learned by experiencing and failing and then just keep getting back up. Let me think. I wish I would have known any. You know, I mean, I had another, no, I feel like this is going to sound, I don't know if this is going to sound, I don't know. I feel like I personally intuitively have always been a little bit ahead of the game
Yeah.
because I am a digger. I'm going to
Mm-hmm.
figure it out. I'm going to find a way. I'm going to get it done. I'm going to just keep looking and asking and looking. So I feel like I've always sought this stuff out. And maybe it was earlier with acupuncture. You know, I think I told you that after I went off the pill at 40, I went to my acupuncturist to get my cycle back on track. And I got pregnant in 3 months on accident, which I truly believe was acupuncture. So I've kind of had my hands in a lot of this for a long time. So, and I was able to maintain some of this stuff for a really long time with with more of the adaptogens.
Mm-hmm.
So I don't know.
Yeah, which is great. And I think
Today
that
I
just,
would, yeah, if I think of it, I'll let you know though. Not to sound like I know everything, but
no,
I am I'm a seeker of information.
yes, which is important. I think sometimes people don't have that. And I think it's
Yeah.
important to like, I mean, your body is your body, right? Like you are in control of that
Yeah.
and you can take responsibility to do your own research. And
Hmm.
yes, like and that's why hiring a professional, like even if like you do your own research and not saying like read every, trust everything you read online, but I think just kind of digging into it and if you truly don't know like what's true, what's not, how should I handle this, reach out
Right.
to a professional to
And
actually
one of the other things I remember when I was teaching yoga, I always told people, I was like, if you listen really carefully, your body will tell you exactly what it needs. But people don't listen. They don't. I mean, they literally are like, I'm not listening. And I don't
Mhm.
know if it's because they don't know how or what they've been hearing has been so shitty for so long they can't hear anything differently or feel anything differently. I do think people become immune to feeling like crap,
I agree. Yes.
right? Maybe. And
And
also this chase, you know, now we have everything out there, Ozempic, the chase to be skinny, like that makes me crazy. And I'm not saying that there aren't some people that need to be on a GLP-1 and need to be under a doctor's supervision because they're going to have diabetes and freaking die and they need to lose 50 pounds. I think that's all great. Like, I'm not going to say no to any of that. But I do think some of these drugs are making it, you know, they're now able to prescribe these drugs to 10-year-olds. Like, why is a 10-year-old like 30 pounds overweight? Like,
mhm.
what's the bigger picture here? You
Yeah,
know?
there's a bigger picture for
Yeah.
sure. Uh and so going back to what you said about listening to your body, I
Mhm.
think there's a lot of people that kind of shove that down
Yeah.
where like you said there's certain symptoms that are coming up that are quote unquote normal that don't need to be normal. Like because they're common doesn't mean it's normal. So truly, I think that's a huge piece of advice. Like listen to your body, listen to the signs it's giving you, whether that is mood swings or oh, like I'm having a migraine like every other week and I haven't experienced that before. Like don't just brush it off, like get to that root of why it's
Right.
happening.
I also think too, like, you know, hair stuff. I mean, my hair isn't that thin, but I look at some of my friends and my daughter's, she has this thick head of hair, which I had that thick head of hair at a very young age. And I would say after I had her and then into it, probably say in the last, I'd say in the last 5 years, it has kind of maintained. I think collagen helps, but I do see a lot of women with really, really, really thinning hair. And that I think is kind of, that would be really hard,
Really hard.
you know.
Really
So
hard.
that's just one of those things. If you start to see those things, you know, all of these are symptoms
Mm-hmm.
of, you know, hormonal changes. And I think for people not to overreact and think that, you know, they are, you know, they're depressed or just a lot of times it's hormones. Maybe look
Yes.
at it from that lens where it's like, it's not that big of a deal. You're going to be fine.
I love the video you sent me on the hormone, like rather than hormone replacement therapy, think of it hormone optimization. But the
Oh, all
other,
the different names of
all the
menopause.
different, do you remember them? What were they?
Yes, I should have listened to it. I'm trying to think. No, but that was good. There were some fun ones in there because it's kind of like it's just such a weird word,
Yeah.
menopause.
It sounds like a
And then when you are in menopause, you want to put men on pause.
Oh God, that's good.
It's funny. I just now thought of that. Like, oh my
Ah,
God, you know what it
that's
says.
so
And
funny.
that's a real thing too. I mean, obviously
Yeah,
being a mom and stuff, but you are just like, oh my God, I wish I could just flip a switch.
right.
Be
Okay.
30 again. Okay.
Any other piece of advice you would give to women looking to stay active, maintain muscle, stay healthy long term in the middle aged?
I just think at the end of the day, finding somebody that's a good match that can help you through your journey. Like you have to find that right person, you know, and I'm grateful that you were referred to me. You know, at first I was like, oh, she's young. I'm sure, like, what does she know? I'm serious. No, I'm serious. This is like the older. And then I was like, oh my God, she's so great. I'm learning so much. But then I think to myself, why wouldn't I go to you and pay you to help educate me so that maybe I can work with some of my clients on? I mean, this is all part of
Full
it,
circle.
right?
Yeah.
And if it's somebody that might be younger that wants something a little bit more, then I refer them to you. Like it's just, I'm not in like the business of personal training to make a living. It's more like
Mm-hmm.
I want to just help people out. And so I would rather learn from somebody like you that's in it and doing it so that I don't have to go to some conference with like 500 people. And like I learn by doing and experiencing. And I will say that most of the things that I've done that I teach is stuff that I've already experienced. And I think that's important. Um, you know, with women and working out, like,
Mm-hmm.
you know, knowing that I have experience in my body and I'm not going to try to get somebody to do something that I might not think they're ready to do because that
Yes.
happen, right? Somebody older might go find a trainer at like a gym that's
Yep.
do box jumps, have, you know, the second appoint, you know, whatever, and they throw their back out or whatever.
Mm-hmm.
Like,
Yeah. I mean, it's really right. Like being in this industry, there's good ones and bad ones, and
mhm,
looking at, yeah, you want to find the right person. Like
yeah.
you click, you connect, and I appreciate you being honest too about your, because
Oh,
I
well,
that
no,
happens all the time. Like,
you could be
no,
my
truly.
daughter.
Yeah, like no, it happens all the time where like you're young, which I understand totally. And so, yeah, I appreciate you like sharing that and like knowing that,
Don't
like
judge a book by
trusting me,
its
right?
cover.
Giving what?
Don't judge a book by its cover.
Yes, and also
You know,
like
like the
yeah.
first appointment, I was like, she totally knows her shit. But I kind of knew you would because Andrew referred you.
Mm-hmm.
And he's like, you guys would make a great match. So he kind
Yeah.
of knew too through, you know, physical therapy,
Yeah.
whatever. But
Yeah.
I do think people, older people, you know, we're still kind of like, well, I don't know. What if,
Well,
you
yeah.
know, she
So
knows
even
more
just
than me. So
try.
that's cool.
Well, and also try on like experiment, like you're saying, like you don't know unless you try. Like
Yeah.
these experiment with
Yeah.
whether it's a trainer, whether it's with, even different techniques as far as
Yeah.
like meditation, walking, like be willing to like step out of your comfort zone a little bit
Mhm.
into in the small ways.
Yeah.
Like that is really helpful. Last question I'm going to
Yes.
ask you is my signature question. So my goal is to help others overcome their fears, lean into growth in all aspects of their life. What have you done in your life that took tremendous growth, but it took like getting out of your fears to get there?
I kind of live my life. I
You
mean,
what?
I think I don't want to say I'm fearless, but
How do
I
you
feel
embody that? Or like, yeah.
um I think losing my mother at a very young age propelled me into a different world and really taking risks. Like I've always been a risk taker my entire life. Um I don't let fear get in the way. Like I'm not one of those people that is always afraid, I guess. But I do know, you know, people do fear. I think people fear success because it takes work in that sense, but I think I've just always been, I always say, I always take the road less traveled because there's more obstacles that I have to go around. And that's what makes me successful. I don't know. Like I just don't take like the easy path.
Easy. Mm-hmm.
Like I think I was that kind of kid too. Like I only know I'm going to make things happen if I stumble through it.
Yeah.
I don't let roadblocks get in my way.
And it's rewarding knowing that
It
you
is,
did that,
yes, my
you
work.
know?
I love, and it's probably to a fault how much I love my work.
Mm-hmm.
You know what I mean? Like I love golf. I love teaching. I love coaching. I love it so much that sometimes it can get in the way of my personal life with my family. Like that is where I feel the most comfortable sometimes. I've said that before, like at the golf course, in my zone, right? But I also think that, moving to Colorado at 24 and packing my shit and just leaving, was probably one of the biggest things that I did in my life. And obviously it's worked out, but I don't know, I'm just not one that I've always been a risk taker. I'm not that cautious, maybe.
Which is a great, I mean, that's a great quality I mean, like you're very intuitive. Like you're very like
Yes, that I am.
trusting,
Yes,
like
yes.
you trust yourself. And
And
that's
faith. I
hard.
do have faith. Like I
Yeah.
always, not always, but a lot of times, like it's gonna be okay.
Mm-hmm.
It's gonna be okay. Like change is inevitable no matter where you go. So no matter what you do, something's gonna have to change or shift. So I
Mm-hmm.
think that, and I'm constantly trying to better and work on myself. Like I think that's a big part of it too. Like if you're not willing to grow and look at yourself in the mirror and be like, yeah, you need to take it up a notch and make some changes, then you never will. So I think that's a
Totally.
roadblock for a lot of people too, you know?
And that takes a lot of effort, a lot of
Yeah.
work, a lot of time, but it's so rewarding when you look back, like you said, and you go through all the obstacles and are willing to work on yourself in different ways. You're gonna become a better person, like
Yeah, I mean,
overall.
I started I got fired from this crazy job. It's such a weird story, but I got fired and my best friend at the time and her husband, they were entrepreneurs, which they were pretty pivotal in me becoming an entrepreneur. And I will never forget when I called them, they were like, that's the best thing that ever happened to you. Now you can do whatever the hell you want. And I became a life coach and then I took golf and wellness. And so it was just one of those things like, yeah, I can do
You could
whatever I
do it.
want now.
Yeah,
It's
it's a
like one of those
mindset
things.
too.
Yeah, yeah.
Yeah,
So, but yeah, I
that's
think it was
awesome.
part of how I was raised too.
That's
And that's
awesome.
important. Yeah.
Yeah, that's really important. And you're raising such a beautiful daughter and teaching her the ways. And
Yeah,
yeah,
she's pretty feisty and independent.
gets it from her mama.
Yeah.
Well,
Okay,
Kathleen,
cool.
this was so
Yes,
fun.
thank you.
I appreciate you coming on. It was such a wonderful conversation. It was so fun.
Yeah,
I know we were all over the board, but I really hope you found value in this
I
podcast.
did. And I hope that
And
others listen to it. And, between people like you and me out there really trying to help people, I think that's the most important thing. So,
100%.
yeah.
Thank you. Thank you.
Okay, cool.